Hi, I'm Thea. I'm a Pediatric Intensive Care Unit nurse here in the UK.
Central London OSCE or London Hospital OSCE. You decide. Our Central London purpose-built NMC OSCE course and practice rooms include all of the equipment you need to practice for your NMC OSCE exam. You get the same expert team by your side, the same expertly prepared materials, and now a dedicated space built just for our international and return to practice nurses. Learn more at www.oscenurses.com.
Hello, Manong George here. Welcome to our channel. And today we have a very special guest.
Hey, my name is Thea. I'm a registered nurse in the Philippines and in the UK. Recently I have transferred from working in a pediatric intensive care unit to a pediatric critical care unit. So in the PQ that I worked for, it's a combination of ICU and HDU beds. So we look after level 3 and 2 patients, whereas the PCCU that I worked that I'm working in now is purely HDU, so we look after level 2 patients.
I work in a pediatric intensive care unit, so I have to change into scrubs, and I wouldn't be able to film my actual work because we shouldn't use our mobile phones on patients' bed spaces.
There's a pediatric intensive care unit, so again, level 3 patients, so they are mostly ventilated patients, intubation, ventilation. So very 1:1 nursing. We also do non-invasive, pero if they're in the ICU, naka-intubate po sila, and they would also have a central venous access. They would have arterial lines. Sometimes we do nitric oxide if they need it, a lot of respiratory support. Stepping down from that, we do high flows, airbo, optiflow, all of.
Manong knows best.
I'm thankful nga po na hinire nila ako kasi background ko sa Philippines is medical, surgical, ER, and then I was a basic life support facilitator. But my pediatric experience was not exclusive kasi medical surgical ward and ER, it's a mixture of adult, pediatric, OB-GYN. So I don't know, but in my application po, I included that I have acute care experience, like in the ER. I assisted with intubation. We do inotropes. We do code, like we defibrillate, and all of the ER stuff. But in the UK, my experience was DME po. So it was a bit different. So it's not an exclusive pediatric care pediatric experience, but they would provide you with the training naman po and support. That's what I really like about the unit, because they supported me to really adjust and learn in the unit, and the staffing is definitely better.
Manong knows best.
For the training po, when I started, we were given 8 weeks supernumerary, meaning we are not included in the numbers. But for those 8 weeks, it's a mixture of study days and clinical shifts where we work alongside experienced PQ nurses. But because I started during the pandemic, I wasn't able to have my HDU course yet. And then after that, I got pregnant. But now that I'm in PCCU, I'm scheduled to take the HDU course.
Manong knows best.
Pros and cons of the job. So number 1 is the workload. So back in DME, the nurse-patient ratio is, for me, it was 1:7 or 8 maximum if you're short-staffed. But in ICU, pediatric ICU, it's 1:1. In HDU, it's 1:1 or 2. So that's definitely, even if they're very sick, they're very unwell, you can focus more on keeping them safe. In terms of moving and handling, of course, because you're looking after babies, children, and young people, moving and handling is easier compared to when I was in DME, where we hoist patients, and it's definitely heavier. In terms of medication, everything or medications are dual sign off. So that's an extra safety feature, and there's going to be less tendency for medication errors. So I love the fact that we have the dual sign off. Next is in terms of staffing, there is better senior support because like what I mentioned in DME, we are asked to take charge like just shortly after passing the OSCE. So in pediatric intensive care, we have a lot of seniors to support us, and there's better staffing in terms of the numbers. And don't get me wrong, I work with amazing colleagues in DME. In the adult ward, but the staffing was really bad in terms of numbers. We're always short staffed, and in PQ, we're not always fully staffed, but still the numbers are better. And even if we're short staffed, I feel like there's always someone to help.
Have my badge ready in case the doors are closed. We use the badge to access the following: the hospital premises, glucometer, blood gas machines, printer, and car park if you drive, so never ever forget your badge. As you can see, there is no Bundy clock for the daily time record, so you don't have to punch in or punch out at the start and end of your shift.
Learnings, you can improve your nursing skills if you're looking for a unit to improve your nursing skills, because again in PQ you will learn ventilators, both invasive and non-invasive. You will learn how to look after patients with central venous access, arterial lines. You will do high-risk medications, complex drug infusions, PPNs. You will learn all of that. So overall, I'm happier with the nursing care that I was able to provide. I felt like I was able to keep my patients safe. I was able to support them, their family better. I have more chance to actually sit with families, especially parents, to just support them, not just physically looking after the patients, but also emotionally. It's more holistic and family oriented, and my pin feels safer because of all of the things that I mentioned.
Oh, yeah.
Because my experience was not exclusively pediatrics back in the Philippines, and even when I worked here, the learning curve was very steep. Like, oh my gosh, I have to learn all of this in a short span of time. Well, I don't know, 8 weeks. It could feel like a long time, but considering the amount of things that you have to learn, for me, it was a lot. If you have pediatric ICU experience elsewhere, then it might not be that steep for you. But for me, in PQ, we do all kinds of calculations, very strict intake output, fluid balance, and different kinds of scoring. So yeah, it's a very steep learning curve. You're gonna get a headache. So
My emotions!
from my experience is the emotional impact of working in a pediatric intensive care unit, because looking after very sick children could hit you differently. I mean, I've been a nurse for years, but it's just really different. As a nurse, you have to maintain professionalism. You have to show empathy and support patients and family, but there will be days that it will just get to you. For me personally, especially after losing my mom during the past few years, for a while, I couldn't look after oncology patients. It was just too much for me because she passed away from cancer. Also, when my patients have a bad prognosis and I know that they're gonna die, it's really difficult. I would never forget a cry of a parent. It's one of the most heartbreaking sound that I've ever heard in my entire nursing career. And seeing a young person suffer is one of the most difficult encounters I've ever had. Oh my gosh, it's getting a bit but it just feels unfair seeing them so sick. But seeing them better is the best feeling. And most of the time, they do get better. A lot of them get better. So you have that, and that is priceless. So that's the pros and cons.
Manong knows best.
So my advice po for those who want to pursue this career path is, well, number one for me is calculator is your best friend, because you will deal with a lot of calculations. I have two calculators when I go on shift. One is a pocket calculator, one is a desk calculator, since we have our own workstation on wheels. So my desk calculator stays there and the other one is on my pocket. So going back, so if pediatric ICU or CCU is in line with your interest, then go for it. If you have relevant experience, highlight it in your application because that will be an advantage. But if you don't have relevant experience, don't be afraid to try because you'll never know. Remember, you're a nurse, you're flexible, you're capable of learning, of changing, of growing, and getting out of your comfort zone. Again, if you want to pursue this career path, good luck and I wish you all the best.
Always remember, Manong knows.
Manong knows best, put your worries to rest when staying in the United Kingdom.